So this is a media briefing by the Kent and Medway Resilience Forum. So that's the local multi-agency forum that deals with emergencies and any emergency response. So it's basically the local resilience forum for Kent. I have with me my colleague who will introduce himself in a second. We're working very closely with the UK Health Security Agency and other partners, and basically we're representing that whole group. Like Joe said, we'll be joined later by UKHSA and Dr. Claire Winslade after the Q&A. So Ed, do you want to introduce yourself?
Morning, my name's Ed Waller. I am the Deputy Chief Exec at NHS Kent and Medway, which is the Integrated Care Board, and I have led the NHS response to this incident since the beginning of this week.
Thank you. So just to be re-emphasizing the purpose, so the purpose is to reiterate help that is currently available in Kent, to reassure people and provide access to the right services and support, and help people to stay safe and well through this particular outbreak. We've been working tirelessly through this week, as you can imagine, to put plans in place and deliver. I have to say the agencies that we've been involved in have been totally incredible in their response and have been absolutely working full tilt to make it happen. In terms of the local picture of what has been set up, I personally am quite staggered by Ed's work and colleagues' work in terms of setting this up virtually overnight in many cases. But I'll turn to Ed about the actual setup locally in a second. I know that UKHSA has done contact tracing for thousands of people, 10,000 plus people, and encouraged them to come forward for prophylaxis. The approach has been from the start and continues to be that prophylaxis is one of the most important things. So essentially the message is if anyone is showing symptoms of meningitis, then they need to approach the NHS, so through 999 or A&E, and immediately seek help because that's potentially an emergency. In terms of the people who are close contacts, so meningitis is not spread the same way that COVID is spread or measles is spread. This requires protracted close contact in order for it to be spread. And that usually is in a household context or in a dormitory context. It requires close contact in the form of kissing, sharing utensils, things like that. So in general, if you're just coming across someone who is positive, you're very unlikely to get the disease from them the way it was with COVID. So therefore, people who are identified by UKHSA as close contacts, they absolutely need to come forward for prophylaxis. So that's basically preventive antibiotics. It's very easy to get it. It's just one dose of an antibiotic. What it does is it wipes out the bacteria from the back of the throat of potential contacts and therefore breaks the chain of transmission. It also protects that individual from having the infection. The vaccination is more the forward-looking thing, so this is to do with onward transmission beyond the immediate surroundings, as well as protecting the people opportunistically who've come forward for prophylaxis for any future meningitis infection. Just to clarify, this particular outbreak is meningitis B, so that's the serogroup. There are 13 different serogroups, and there are different vaccinations for different serogroups. So the serogroup identification has helped with identifying which vaccine. So I'll turn to Ed to just talk about the local arrangements.
Thanks, Anjan. So our local response has effectively in the NHS comprised two parts. The first was the standing up of the antibiotic prophylaxis clinics, which Anjan described. So they ramped up during the week. The details were available on the ICB's website, which I'll give you in a minute. The peak distribution of prophylactic antibiotics was on Tuesday, where we delivered more than 4,000 doses, and we have delivered almost 10,000 doses of antibiotics at those clinics as of this morning. The second operation is as an operation to mobilise a vaccination programme that's slightly more complicated because of the nature of vaccination. That involved us drawing down stocks from national supplies of meningitis B vaccine. And we have, within 24 hours of the Secretary of State's announcement, set up a vaccine clinic on this site, which started operating on Wednesday and delivered more than 600 doses. That operated through yesterday. it responded to the change in cohorts during the morning and has again started delivering today. This morning, 3 other vaccine sites started to deliver. They opened yesterday afternoon, but at full throttle today. So as of this morning, we have 4 vaccine sites, 2 in Canterbury, 1 in Ashford and 1 in Faversham, delivering both prophylactic antibiotics and the vaccine. And we have delivered more than 2,500 doses of vaccine to eligible people who are presenting at those sites.
Thanks, Ed. So you would be aware that the Secretary of State announced yesterday an extension of the criteria for vaccination and a tweak to the program, which is quite significant. Initially, it started with the vaccination of University of Kent students. Now the message is very simple. If you have had preventive antibiotics in relation to this particular incident or are eligible for it, you are also eligible for the vaccination, so please do come forward. To be clear, the vaccination is now extended to everyone who has been offered preventive antibiotics. So even those who've had it in the past, they can come back and get the vaccination. It'll also be offered to sixth form, that's year 12 and 13 students as well, so not just university. The other important thing is that the University of Kent students who are dispersing because of holidays, Easter, but were eligible and have moved somewhere else for basically gone home, they can also access the vaccination if it's outside of Kent from their GP practice. If it's within Kent, then please come back to the sites. The symptoms, like I said, of meningitis are initially it starts almost as if it's a viral infection, so you just feel unwell, but it very rapidly then goes on to having a fever, having a headache, having a stiff neck, something called a non-blanching rash. So basically it's a rash which if you press a glass against, it doesn't disappear. You could have pain in the joints. You could also have diarrhea and vomiting. If it progresses still further, then it goes into things like convulsions, loss of consciousness, and that's the really, really serious end. If anyone has any of these symptoms suggestive of meningitis, then please call 999 or go to your A&E. If you've been, or anyone you know who's been in contact with someone like that, then please come forward for prophylaxis because you may be a close contact, but only if you actually have been in close contact with a known case. In terms of the latest numbers, you would be aware that every morning that's published. So there are 29 cases as of yesterday, 5 p.m. 18 are lab confirmed and 11 are under investigation. And sadly 2 died, so condolences to the families of those who did. Luckily, we've got no further deaths to report. So we'd like this morning to stress this briefing's importance, which is basically to give the message out for people to act quickly if they're feeling unwell and showing symptoms, and also encourage people who are eligible to come forward for the vaccination. So we'll end the briefing here unless, Ed, you had anything to add?
Only to add my thanks to all the NHS members of staff who've gone well above and beyond because of the care they have for the people who they serve in Kent and Medway. So for the people working overtime through this weekend, I wanted to extend the thanks of everyone here.
And I'd like to say that too. So thank you, everyone. And are we taking questions at this point? Yeah.
Simon Jones from BBC. Can I just clarify, when you talk about sixth form, you're just talking about sixth forms from 4 particular schools?
That's right. Yeah.
Given you've massively extended the vaccination program, how many people are you expecting to come forward for vaccinations, and how many vaccines do you have?
Ed?
So if I start with the vaccinations, 6,500 doses of vaccine have been delivered to Kent and Medway from the national stock, and there was a request today for another 5,000. We will keep that under review as the vaccination programme rolls out. And in terms of numbers of eligible people, it's quite hard to put a precise number on it because of things like the number of people who attended nightclubs and things, and the crossovers between different cohorts. So we're working on the basis of eligible cohorts rather than giving you a number.
But you must have a number.
We have numbers that we're using to plan, but I can't give you a precise number given the overlaps between the cohorts. We are going to vaccinate everyone in the cohorts who arrives at the site.
You've got 6,500 and you're requesting another 5,000 at the moment.
Correct.
Thank you.
Ciprofloxacin is not your average antibiotic. I'll read from the patent leaflet. It can cause prolonged disabling and potentially irreversible serious side effects. None of this is mentioned on the leaflet that's been given to the young people. The UK HSA guidance states close contact is defined as prolonged close contact. It does not include, for example, students or pupils in the same school, work, school colleagues, friends, or even kissing on the cheek, only prolonged kissing. Are you following the HSA guidance on close contacts, considering we've given 10,000, almost 10,000 vaccinations out? Have you cast the net far too widely without considering basic safety and informed consent?
Sorry, you're conflating two things because you asked a vaccination question in the end and you started with prophylaxis. So the prevention part in terms of antibiotics, all antibiotics have side effects, and there's a kind of a lot of study done about the rarity of them. So the antibiotics are not to be given out willy-nilly. So they are specifically for people who through UK HSA's contact tracing process have been identified as close contacts. Those are the people eligible for the antibiotics. The vaccination program is, yeah, so you, yeah.
And are you confident that 10,000 people are close contacts of the 29 cases?
Yes.
Close contacts under the definition of the UK HSA guidelines?
There is a little bit of an abundance of precaution approach here. In terms of the actual contact tracing, my UKHSA colleague will be coming in later, so you could ask her the specifics about that. My understanding on the ground, because it relates to specifically one incident which was like a super spreader event, so the nightclub in Canterbury where a lot of that is traced back to, the numbers there as an overabundance of precaution because of the nature of, I guess, interaction in a nightclub setting, that everyone in those nightclubs who were there have been made eligible for this. And that probably is one reason why those numbers are high.
Just to put you on the point of informed consent, you're not giving out a copy of the patent report, for example, to people which were given before. I mean, people are generally advised, always readers believe that before they take the drug, these children aren't being given that information at all.
I'm not that close to the operational.
So the operational teams at our sites have been giving people information leaflets and what's called the patient information leaflet that describes the product, the drug.
I think people are still a bit confused as to why you consistently said, people are a bit confused, you consistently said it's prolonged contact, close contact, and yet it seems disseminated from contact over maybe just a few hours as well. How can you square those two things in terms of your advice?
Okay, I'll explain it a bit more. So close contact is in two situations. So one is if you're cohabiting, so whether it's a dormitory or a household contact, so you have enough time to actually be exposed. So that's one situation. The other situation where it's intensive contact. So, for example, if you were to kiss someone on the cheek, you're very unlikely to get it if that person has meningitis B. But if you're engaging in intimate kissing, then you would be likely to get it. There is some research that is being done about the theory that the sharing of cups, beers, vapes also contributed to that. Meningitis B is transmitted through saliva, and the science of it is something called QQR. So it's quality, quantity, route in order for a transmission to successfully take place.
So, for example, just sharing a vape could be enough for it to spread.
In theory, yes, could be, yeah.
So the prolonged bit is maybe just in regard to
That's right. Yeah. Yeah.
Do you think you should adjust some of your guidance from the word prolonged and close contact?
That's something, again, it's above my pay grade in terms of what the guidance is. That would be UKHSA if you asked them when they join in.
Benji Michael from LBC. I know that on Government UK's website, and it was, further espoused by the Health Secretary yesterday, that students continue to live life as normal, and many will live life as normal. That means cohabiting, that means doing these things, shared utensils. I wonder whether at what point, that should be changed, and it's recommended that they do change their behaviours if that's advised.
Good question, but essentially everyone who's a known case is now in a hospital setting. So the cases, in other words, the places from where infection can spread, are no longer in the community. Close contacts of those cases are themselves at risk of obviously getting the disease, but until they do, they're not at risk of spreading it further because they haven't even got it yet themselves. Now, given that fact, and also the fact that the actual transmission requires this close contact, means that most people who are not in those categories, so someone who's not exposed to a known or suspected case, is not at risk. So it's not like COVID, it's not spread the same way, it's not spread through aerosol routes, so it's a very different profile, and therefore there's no reason for people to not be going about leading their normal lives.
Just on the point of being infectious, that is until symptoms start to show. So there's an incubation period, say 10 days. During that time, non-infectious, and when they start to show symptoms, they are. Is that right?
Not quite. So the infectious period ranges from 2 to 10 days. A person is infectious from 7 days before the onset of symptoms till 24 hours after their treatment starts. So that's the science.
Yeah, Jane Dean from Channel 4 News. Given what you've experienced and been through and are going through in Kent, do you think the Joint Council on Vaccination and Immunisation should recommend a national vaccination programme for young people with meningitis B?
Well, that would be for the age group, university age group students that you're referring to, right? Because because there is a vaccination for 13 to 14-year-olds, and beyond that, then it is this group. This has come up many times, and JCVI has looked at the evidence and then decided on balance not to recommend it. I'm sure that they're going to look at this, probably they already are, to see whether that should change, because the profile of some of this particular instance are highly unusual. It's never happened that we've had so many cases at such a pace. So there is something in this which in the round the research will start to establish, and based on that I have no doubt JCVI will look at that and make a informed decision again. Now it well could be that they still decide it's not eligible, that group, or who knows, they might think that.
Personal or professional view?
I can't say till I look at the evidence myself. At this point, it's too early to say.
Hi, I'm Lara Wilderman from the Times. Can you talk about the risk of students travelling home to their families? What is the residential advice to students still here who might not have symptoms, but they know people who have?
If you're a student in that category and you're deemed a close contact, then before you go home, take the prophylaxis from the university. If you've already moved before you got the prophylaxis and you are still identified as a contact, contact your GP, and the prophylaxis can be arranged via your GP. So that would be the standing advice. For everyone else, there's no reason for people to be worried. If you're eligible for a vaccination, like I said, and you live on the University of Kent campus, you reside in one of the halls, then you are eligible for the vaccination. And if you've already moved, then again you can get the vaccination from your GP if it's outside of Kent. If you live in Kent, then come back here, get your vaccination.
Do you know how many people are still in hospital at the 29?
Off the
I think they've
Yep.
been hospitalised, but they're still in hospital.
I think one has been, don't quote me on that, I'm not sure 100%, but one has been discharged as far as I know. The rest are still in hospital.
28 others.
Yeah, yeah, yeah,
Yeah.
yeah, minus the 3, if you like.
Yeah.
So 27, it would be something like that.
Do you know what the proportion is compared to University of Kent students as opposed to sixth formers?
Just bear with me a second. There were, as I'm just trying to remember it because I don't have the data to hand, it's about 12 University of Kent students were cases,
Yeah.
last I remember.
Could you talk a little bit about the concept of the super spreader effect? We've identified 3 nights. Are you suggesting that the same group of people went on 3 nights in a row and have spread it to different groups of individuals? Is there staff at the club? Or is it that you're just guessing that it might be one of those things?
Really good question. So UKHSA has done a lot of work behind the scenes, tracking each and every person back to their movements, etc., looking at who they came in contact with, hence the contact tracing. And they've created a really great model which basically shows where it's suggesting. So all arrows point, not all, but many of those arrows point to the common place being club chemistry, 5th, 6th, and 7th. So therefore, that is basically from an epidemiological point of view, too much of a coincidence that that is not implicated in this. Just, I forgot to add another thing in terms of the vaccination and prophylaxis coverage. The dates initially that we proposed and promoted were anyone who's been at club chemistry on 5th, 6th, and 7th. Now it's from 5th till when it closed. So it closed on the 14th of March. So essentially anyone from 5th till the 14th of March is A, eligible for prophylaxis, B, eligible for vaccination as well.
There are people who may have become infected on the 5th, 6th, and 7th, back to the club in subsequent days. So it was being seeded right through potentially till the 14th or whatever. I'm just articulating this. Therefore, add another week or 10 days to that, you could be seeing cases right through to the next week.
Yes?
And there could be, there was a suggestion that it peaked in terms of the 13th of the day, although there was a bit of rowing back from that. Is it possible it hasn't peaked, it is, we can't say anything until you've got all that later to the next week?
I would say yes to that. So I was asked yesterday about is this contained, and I was saying that we can't say that yet for many of the same reasons that you've just said. Now, the reason the date has been extended on is because cases that are coming now, if you backtrack their incubation period and the fact that they are all connected with club chemistry, it's beyond the date. So there's cases which have been emerging where they have gone to club chemistry, but not on 7th, but after that, 8th, 9th, that kind of a thing. So therefore, the thinking is basically to extend those dates. There might be more cases. We don't know. And we will not know for sure till next week. Now, there are 3 rough scenarios which are actually being modeled, if you like. So those are the scenarios over the next 4 weeks. And because that's the time it takes for this whole thing to really subside. So it takes about 4 weeks. Now, the first scenario is it stays more or less contained in Kent. And whatever cases we're seeing, there's a few more, like you just said, Hugh, which add to that number. And that's it. Second scenario is that there are people who've left, so they've gone off campus, and many of them don't stay in Kent, so they go and stay elsewhere. They were incubating when they left, and then they become cases, and there are small household sporadic clusters outside of Kent. So that's the second scenario. But they're all containable. They're not really major things. Third scenario is a worst case scenario, which is basically that those cases which have gone out of Kent, that results in another cluster outside of Kent. So those are the 3 scenarios. The most likely is the second, which is that it'll more or less stay contained in Kent, but we could see some sporadic household cases outside of Kent. So that's the one where the thinking is that's most likely to be the case. The third one, the worst case scenario, in other words, is highly unlikely.
By sporadic outbreaks in the household, you mean outside Kent, but you can do the contact tracing quickly.
Yeah, yeah, we know them. So,
There was one in London yesterday.
yeah.
Okay, I think we're going to have to draw it to a close to allow you to have ample time for your interviews. So we're going to call you one by one. Anjan, please join Wednesday.
Yeah.